Alright, so the first thing we're going to do is we're going to check our chart. We have a 25-year-old male weighing 165 pounds and is 5'8". He has a history of post-op cabbage and smoked 1 pack per day for 10 years. And he has no history of lung disease. So I'm going to wash my hands, put on gloves, go into the patient's room, introduce myself. Hello, Mr. Smith. How are you doing today? My name is Geraldine. I'm with Respiratory. We're here to try to do a weaning trial to extubate you today, okay? First thing I'm gonna do is take some vitals, listen to breath sounds and everything, heart rate. Initial vital signs were temperature of 98.7, SATs of 95, heart rate 80, blood pressure 110/65, respiratory rate 20. He is on the Puritan Bennett 980 ventilator on SIMV pressure support mode. Set tidal volume is 650, set rate of 10, peak of 8, FiO2 is 50%, and pressure support of 10. The patient's spontaneous tidal volume is 550 and rate of 12. His alarms are all set correctly. 30, rate 30, high rate 30, low rate 10. High tidal volume is 1300. Low tidal volume is 250. Breath sounds are diminished with crackles. We got a moderate amount of blood thin and frothy sputum. The most recent ABG showed pH of 7.38, PaCO2 of 42, bicarb 22, PaO2 72. After some labs were taken, sodium, potassium, and calcium were normal. Hemoglobin was 12. Red blood cell count was 4.5. Chest x-ray came back with patchy air indicating pulmonary edema, which is a cause of respiratory failure. Some side effects can be vomiting, bradycardia, and hypotension. Before we do the weaning trial, we are going to give him diuretics. So we are not going to be able to do the weaning trial today, being that he has to get Lasix. So he will come back after 24 hours and try it again. Okay, so we came back. It's the next day. We're going to do everything all over again. Take all vitals again. So he got the diuretics. So and he sounds good. He looks good. And we are going to wean the FiO2 to 40%. And we're going to lower the peak to 5. So the doctor has ordered to place the patient on spontaneous trial for 2 hours, and we're going to do the weaning assessment. So we're going to switch him to spontaneous. And we're going to do the weaning assessment. After we did that, we got a vital capacity of 2.1, NIF of -30, and PIP of 20. We dropped the rate to 6 and lowered the tidal volume after that. Could you just squeeze my hand and raise your arm or move your leg if you can? Okay, he was able to do that. We're just going to reassess the patient, take vitals again. Everything was good. Now we're going to chart everything and let the doctor know that we have done the weaning assessment and that he is able to be extubated today.